Hello, everyone. I am here with Dr. David Rosensweet and Dr. Papanik, and we are excited to introduce you to today's guest expert, Dr. David Brownstein, who is a board-certified family physician, partner at the Center for Holistic Medicine in West Bloomfield, Michigan, and the author of 15 best-selling books, including Overcoming Thyroid Disorders and Iodine, Why You Need It, Why You Can't Live Without It. We were chatting earlier about a recent talk you did with Dr. Berkson called Let's Talk Iodine, and we were really excited about that talk. And so we wanted to bring you here today to spend some time diving deeper into iodine, breast health, thyroid disorders, and all the things. So we want to thank you for being here.
I'm happy to be here. Thank you for having me.
And some of the background for this, David, is that just for example, as we view mammogram reports and we see, I don't know what prevalence of increased breast density and fibrocystic breast disease and how unhealthy that is for the breast. And the bottom line in the work we do is preventing breast cancer to the extent that we can. We just want to let you know a little bit of our orientation there, how important it is that every woman that we see and treat, that we bring this into the picture. So yes, sorry to interrupt there, but talk to us about iodine.
Well, we were talking before we started recording that, I wasn't taught much about iodine in med school. What I recall, my iodine training was that iodine deficiency caused goiter of the thyroid. That was rectified with the use of iodine salt in the 1920s. And that was the first public health miracle in the United States. And then because iodine salt is still available, iodine deficiency is a thing of the past, and that's it. And that was my understanding of iodine until I started practicing integrative medicine and started looking, started questioning everything that I was taught at that point. And iodine became one of them. And, finding that iodine deficiency is not only alive and well in our modern world, it's worse than it was 50 years ago. It's worse than it was 70 years ago. And, our iodine needs are higher than our predecessors' iodine needs were because of all the toxicity in the environment. And you guys got to lead me here with what you want me to say here.
Well, do you still see goiters, or is it on a functional level of just an under-functioning thyroid based on insufficient iodine, for example?
So in the turn of the 20th century, when the population was expanding from east to west, there was a goiter epidemic in the Midwest, and it was right around the Great Lakes, centered around the Great Lakes, which it was Wisconsin, Indiana, Illinois, Michigan, and that four-letter state to the southeast of us starts with an O. Lowercase o. And you all have to see what I'm wearing today. Happy to be here as the defending national champion in football. So there was a goiter epidemic, and this reached the highest levels of our government at the time. And the reason it reached the highest levels of our government was because there was a problem with the animals, the farm animals being raised. They were having thyroid problems, and they were not procreating correctly. They were having disrupted architecture of the thyroid glands as well, and they were not growing to the right size. And there was a worry from the highest levels of our government that the human population in the United States was going to outspan the ability to feed it. And we weren't going to have enough animals procreating and growing to the right size to feed the human population. So there was a study done outside of Akron, Ohio. I'm sorry, it was from Case Western. What city is that? It's not Akron, but it's near Cleveland. There was a doctor in medical school wrote a paper on iodine that was called to do the iodine studies to find out what's the minimal amount of iodine added to farm animal feed to prevent thyroid problems and allow them to procreate and grow to the right size. He did the study, and he estimated the minimal amount humans would need to prevent goiter. And the easiest way to get that in people was iodine salt. And there were two studies done, one in Ohio, one in Michigan. And they found the same thing. Goiter epidemic was huge. And they put iodine into salt. And 4 years later, the goiter epidemic was markedly lowered, which is the introduction of iodine and salt.
Can I interrupt you for just a moment? What was the mechanism of the infertility in the animals? Was it thyroid based because of low iodine, or was there more to it?
They never, it's not written much about it, except they were having problems procreating. I'm sure it was iodine is concentrated in the glandular tissue, all the glandular tissue. The highest concentration of iodine is in the thyroid gland, but you have the breasts, the ovaries, the uterus, pancreas, salivary glands, all concentrating iodine. You can't make any hormone in the body without iodine. So yeah, it was probably thyroid problems, but it's also all the other adrenal, all the other glandular areas were suffering as
Okay,
well.
nerd question. How does iodine figure into the creation of the ovarian and testicular and adrenal hormone?
So iodine, one of its main jobs in the glandular tissue is to maintain the normal architecture. So we call this normal architecture. It's normal. And iodine deficiency in the glandular tissue, the first thing you get is cysts. If it goes on longer, they become hard and nodular. They take a hyperplastic appearance, and cancer is the end of that route. Now, as this is going on, they get disrupted function as well.
Yeah.
You're going to get disrupted hormone function. And in animal test tube and human studies, iodine's been shown to halt and be able to reverse this progression wherever it catches it. So the easiest way to get iodine into a human population is in salt. And the government instituted iodized salt around 1928 for the country. And the goiter epidemic in people was solved. And it was hailed as the first public health miracle. Remember, the amount of iodine in salt, which I believe is 75 micrograms per gram, it was set up to prevent to give the people the minimum amount of iodine to prevent goiter. It was not set up to give the body the optimal amount of iodine it needs for proper adrenal gland functioning, thyroid functioning, ovarian function, breast, the rest of it. And the quandary we're in now is our iodine requirements have gone up over time because our exposure to toxic halides, particularly bromide and fluoride, have gone up over time. And that's kicked out more iodine in our bodies. And, the government studies have shown iodine levels have fallen over 50% over the last 50 years. And at the same time, we were exposed to all these toxic halides, bromide and fluoride, in increasing amounts. And we're suffering the consequences of it. We have 1 in 7 women with breast cancer across the U.S., 1 in 3 older men with prostate cancer. We have fibrocystic breast disease at an autopsy study. This was about 15 years ago, showing 88% of women having fibrocystic breast disease. Most didn't know it. We know that's a precursor to breast cancer. When I was in med school a long time ago, I saw pancreatic cancer. I saw pancreatic cancer in alcoholics and old people. Now I got people in their 40s having pancreatic cancer. I saw women with breast cancer postmenopausal and older. I didn't see very many premenopausal women with breast cancer back then. I've got a funeral to go to on Sunday of a 38-year-old woman who was diagnosed in her 20s. I went to a 31-year-old funeral who was diagnosed at 18. I got a couple of teenagers with breast cancer. I didn't see the men who I saw 30 years ago with prostate cancer were old. Now you got guys in their 40s being diagnosed with prostate cancer. We got a mess on our hands. And I think this mess is caused not solely, but, I think iodine is a large piece of that mess pie. And unless we correct that, I don't see where we're making progress in any of these major problems affecting us.
Can we jump to your favorite protocol of iodine delivery to your patients? If you have a specific one, like what your favorite products are, your favorite way of delivery, your favorite amount?
Well, when I started using, so the first 10 years of my practice, I started with holistic medicine 30 years ago. And my first start was into bioidentical hormones, particularly thyroid and other hormones. And so I was diagnosing all these people with hypothyroidism and treating them with desiccated thyroid hormone. They were getting better and I was happier and they were happier and the practice was growing, but it was bothering me. Why do so many people need thyroid hormone just to feel good? And I would try the various cofactors to get the thyroid to work better. And I would try selenium or B vitamins or magnesium, vitamin C, and iodine was part of that. The highest concentration of iodine in the body is in the thyroid, and you can't make thyroid hormone without iodine. T4 has 4 atoms of iodine attached to thyroglobulin, and so on. So once I would try small doses, medium doses, large doses, but I was using SSKI primarily, saturated solution of potassium iodide, DIDE, the reduced form of iodine. I didn't see anyone get worse from that, but they didn't get better. It was only when I met an iodine researcher, Dr. Guy Abraham, who had written an article to one of my journals saying that he developed an iodine loading test. I called him. He became interested in me because of where my practice was located, right smack in the middle of the goiter belt. And we became friends, and I would fly out to California 6 times a year, spend a long weekend in the lab with him, and long days. We were long days in that lab testing iodine levels, refining iodine levels, and studying. We had books, and we go through these books. And Dr. Abraham, when I first started with him, I said to him, iodine's not working for me. And he said, what form are you using? And I told him, SSKI. And he said, well, there's iodine, DINE receptors in the body as well, the oxidized form. To get a whole body effect, you need both a combination of iodide and iodine, the reduced and oxidized form of iodine. So once I started using that, then I started to see the results. So the answer, long-winded answer to your question is that I use Lugol solution, old-fashioned Lugol solution developed by Dr. Lugol in the 1820s, the most used medical item till patent medicine took hold in the right after World War II. I use Lugol solution, 5% Lugol solution or tableted Lugol solution. And average doses of my patients are 25 to 50 milligrams. If they have glandular disease, I use more. And that's the Cliff Notes version of, how I use iodine.
So Lugol's, you use an eyedropper and just put it in water, and are you careful with the enamel of the teeth, or how do you, what's some further details?
So Lugol's comes with a dropper, and one drop of 5% Lugol solution is 6.25 milligrams of a combination of iodine and iodide. And so to get 25 milligrams, it's 4 drops. 8 drops is 50, and so on. You can put it in water. You can put it in whatever you want to put it in. The one issue with Lugol solution is it stains, and it's a drop. Some drops look a little different size than other drops, but you can get a little more precise with tableted Lugols, but I haven't found that to be a big issue. Is a drop type thing. And some people don't like the taste of Lugols. It's got like a metallic tin canny taste that some people object to. But now there's a bunch of companies making tableted Lugol solution, and that's become sort of a non-issue.
Is iodoral in that category, or?
Iodoral is what Dr. Abraham formulated. It comes in 12.5 milligrams per tablet. It's made from Lugol solution. Biotics has one. It's Iodozyme HP. We make our own at our office. We call it iTab. There's a few other companies out there who make tableted Lugol.
Can we get it from you?
Pardon me?
Can we get iodine from your office, or is there you got a website?
We can. Yep. It's we make our own because we wanted to control the manufacturing of it and ensure that it was what it says it is on the label. And it's interesting. When I was doing the testing with Dr. Abraham, I had all the equipment. I used to do my own testing in the office. I never liked it. I hated being in the lab. He loved being in the lab. I mean, we go for breakfast around 7 in the morning. We were at that lab by 8, and we would be there till 8 to 10 at night. And I liked being around him. I didn't like the lab, but I used to test it. And so people would, it was funny. Iodoral was the first one on the market. That was his product. And then I was at a conference and someone handed me a bottle and said, this is half the price of Iodoral. And you look on the label, it says the same thing. So I open the bottle and I see the color of the pills are different. Iodine has a distinguishing brown color to it. Iodide, DIDE, the reduced form is clear. So if it has iodine in it, it's got to have this brownish iodine color to it. Well, I looked at and it was a yellow color. It wasn't brown. So I asked him, I opened it up right in front of him. I said, hey, this color's off a little bit. You sure there's iodine in here? He goes, yeah, there's iodine in there. We make it with Lugol solution. And capped it up, took it home, went to, that weekend, the following weekend, in my office, I did a little study and dissolved it and could measure no iodine in it. And I have a lecture on this. So I called him up and I said, I don't think there's iodine in this. No, there's iodine. We use Lugol solution. I said, tell me how you make it. And he hemmed and hawed because the label said he made it. So finally, I'm like, this conversation's getting a little bit heated. And I said to him, I did a mass spec on it. I did the ICP. I did the analysis of it. There's no iodine in this product. And finally he says to me, well, Joe in Wisconsin made it for me. I'm like, well, your label doesn't say that. It says you made it. He goes, Joe, I got to call you back. So he doesn't call me. I call him back and he's again being evasive about it. And I said, I had a friend, Charles Hakala, who's a pharmacist, who we didn't know what the color was. We knew it wasn't iodine. And it was a yellow color when you dissolved it into a acid solution. So he did I can't think of what that's called, where the different peaks come for different items. It's like a mass spec thing. But he did an analysis and said, it looks like yellow dye number, whatever it was, 4 from the grocery store. He didn't know what it was. Because it's real close to that, but it's not that. I'm not sure what it was. So I call him back. I really hit him hard with, now look, this is not what's in this thing. And he said, fine, we used riboflavin to try and get the color right. And we used iodide because it was cheaper, and we used riboflavin to color it. And so the moral of the story was, you got to beware when you buy stuff. And the labels are not always as they seem. And I've certainly found that out over 30 years.
All right.
Sorry. If you don't mind, You speak in your book about what we learn about nutrition and iodine in med school, which was so very minimal. It seems as if iodine was largely demonized almost throughout my education. You don't need it. There's enough in salt. There's no need to supplement. Can you speak to kind of the supplementation as well as the risk of hypothyroidism from treatment versus hyper, and how often that's actually happening in clinical practice?
So I was in med school from 85 to 89, and it was demonized too.
Mm-hmm.
And if you Google my name and say taking iodine, a Hashimoto's patient taking iodine is like pouring gasoline on the fire or something like that, you'll see my quote. It was from early on in my holistic career when I thought nobody should take iodine. It was dangerous for people with Hashimoto's disease. Now I say iodine deficiency is what causes Hashimoto's, and iodine's the treatment for Hashimoto's and Graves' disease. But so iodine was demonized in med school. That the goiter epidemic was cured with iodine salt. You don't need any more. And iodine will cause or worsen all thyroid problems if you give it to a patient. So I was reluctant to use it until I started looking at functional biochemistry and looking at my patients. And then the first 10 years of my practice were hard with iodine because there was no good testing available at the time. So Dr. Abraham came up with that iodine loading test. Once I started testing people, I knew they were deficient. Then I lost my fear of iodine. And I learned about it, and I started
David,
using it.
would you pause and talk to us about that iodine loading test?
So the iodine loading test is it's a functional test where 24 hours of urine is collected. So at time zero, you empty the bladder. After the bladder is emptied, you take 50 milligram load of iodine, and then you collect 24 hours of urine. And what you're measuring, the iodine taken orally, 98+% will be cleared through the kidneys and cleared out in the urine. So if you take a known load here orally, and you pee out a certain amount, you can subtract the numbers and figure out what's the body holding on to. So what we found is that when there's iodine sufficiency in the body, which occurs when there's about 1.5 grams to 2 grams of iodine, that means all the iodine receptors are saturated with iodine throughout the body, that when you take 50 milligram load in, a healthy person will excrete about 90% of that, or 45 milligrams. And 5 milligrams is the reusable load that's replacing what's been used up in the body on a daily basis. If you take in 50 milligrams, and let's say you pee out 25 milligrams and hold on to 25, that would signify that you're more deficient. The more you held on to, the more deficient you are. It's similar to the old magnesium loading test that used to be done, or you can still do it today. But so this is the only functional test for iodine. It's not a perfect test, but it's a really cool test, especially when you're getting started with iodine and I always tell doctors, like when I lecture to them, your first dozen patients, do this iodine loading test. Repeat the test in a month or two and repeat it in 6 months. So you can sort of judge how that test is changing. And what you'll see with people who are iodine deficient is the first test, I'm just throwing out numbers here, but they'll pee out 50%. On the second test, a month later, they'll pee out 75%. On the third test, a couple months after that, they'll pee out 85%. And then 6 months later, if everything's saturated, they'll pee out 90%, and then they'll just maintain around 90%.
That's if they're being treated.
If they're being treated, and if they're continually taking iodine, because we're not iodine camels. We don't have humps of iodine to store and to draw on in times of deficiency. Iodine's constantly used, and either take it in on a daily basis or you'll become deficient on a daily basis, particularly in our world.
Yeah. So here is a functional medicine doctor. You're seeing a lot of people that you are suspecting are hypothyroid by symptoms and exam, and even by testing. Is your first go-to to give them iodine these days?
So the first 10 years of my practice, the first go-to was give them thyroid hormone.
Yeah, right.
And they were better. I thought I was doing a good thing, and it was just bugging me. I had 75% of my patients on thyroid hormone the end of 10 years. And then there were 2 articles that came out in the 10-year time period. And the two articles, one article, they're by the same author, Eskin. One article said, if you're on thyroid hormone the longer you're on thyroid hormone, the higher the breast cancer risk goes up for women. I believe I should have looked at this before I came on this, but it went up significantly over 10 years of thyroid hormone replacement.
No kidding.
So it was like 30 or 50%. It was a large rise of breast cancer, 30 or 50% rise versus women who weren't on thyroid hormone. So I consider myself pretty good at reading studies. I'm pretty good with statistics, and I read that study, and I couldn't come up with a really good argument for why the study's wrong. And I'm thinking to myself, hey, I thought if they were hypothyroid, they'd be an increased risk, because there's studies that show if you're hypothyroid, you increase risk of breast cancer. Now this study's showing if you're treating them with thyroid hormone, the longer you treat them, the increased risk of breast cancer goes up. So I'm like, the heck is that? Then short time later, another study comes out and says one of the studies was just on thyroid hormone and breast cancer risk. The other was on the length of time you're on it. So there were two studies that came out with that, and I couldn't rectify either of them, and it created cognitive dissonance up here, and I really had trouble with that. And I put them away, and then I would bring those studies out every 6 months or so and read them again. And here I'm treating all these people with thyroid hormone. I'm like, am I making their breast cancer? Am I making these women increased risk of breast cancer? What am I, what am I doing here? But I couldn't come to terms with these people telling me they're feeling better on a little bit of thyroid hormone.
Yeah.
So at the end of 10 years, I would say I have 3/4 of my patients on thyroid hormone. The average dose was 2 grains or 120 milligrams. Then I meet Dr. Abraham and I start testing everyone, and 97+%, and initially it was higher than that. As people start reading my books and seeing lectures or something, they start taking iodine. They had normal iodine levels, but at first everyone was low in iodine. But it was my numbers right now after testing over 8,000 patients between me and my partners, 97 points, it's like 4 or 5% are low in iodine, most significantly low in iodine. So then I started using iodine. And now 20 years later after that, I have about 1/4 of my patients on thyroid hormone. I was able to get, half of them off it. Out of those 1/4 that are on thyroid hormone, my average dose now is 30 milligrams instead of 120 milligrams. They're on lower doses. And now I feel like I have taken care of more of an underlying cause of their problem. And I'm sure now I'm not increasing breast cancer risk. So when I teach doctors about iodine, I always say, if you're going to put them on thyroid hormone, you better make sure they have enough iodine in their bodies, because you can worsen this breast cancer risk.
Wow.
And, perhaps we're seeing 1 in 7 women with breast cancer because iatrogenically, we're accelerating that with the amount of thyroid disease that's across the United States right now.
David, this is absolutely amazing. I remember a mentor of mine in thyroid said, before the age of 40, you can give people iodine who are functionally hypothyroid and you'll get some results. But after the age of 40, you should not give iodine. You should treat with desiccated thyroid. And this is a long time ago that I heard this.
I was doing that a long time ago, and you can get quotes of me saying that. So some people who disagree with me, there's a lot in our holistic world that disagree with this, especially in the naturopathic world. And they come after me on this topic, and they'll use my old quotes against me. And I'm like, use the quotes. I think the quotes are great because I was ignorant back then. I was iodine illiterate back then. I was not iodine knowledgeable back then. I am now. But my counter argument to them is easy. So the question I would ask 3 of you people is, have iodine levels gone up or down over the last 50 years according to the National Health and Nutrition Examination Survey? They've gone down 50% across the United States. During that time period, has hypothyroidism, Hashimoto's disease, Graves' disease, breast cancer, all the stuff we're talking about, has that gone up or down over the last 50 years? That has gone up epidemically. Same time iodine levels have gone down, and that's a negative association between those two. Now, we all know a positive association with, A plus B does not mean A causes B, it could be other things, but a negative association disproves iodine causing Hashimoto's disease, the epidemic of Hashimoto's disease, Graves' disease, breast cancer, and so on and so on. It could be iodine deficiency causing this, but it could be something else. But when you look at the old literature and the old case histories, they used to treat Graves' disease with iodine starting in the late 1800s and the early 1900s. I've used that so many times. There's 6 of us in our office. We like when Graves patients come in. They're miserable. They don't feel good. They're offered radioactive iodine treatment to burn their thyroid. But not only does it burn their thyroid, it burns their breasts. It burns their ovaries, burns the prostate, it burns the pituitary, burns the hypothalamus. It's changing the DNA all over the body. Thus, the association with increased cancer risk years later after radioactive iodine treatment. And after 20 plus years of using iodine to treat these things, I have never sent a patient for radioactive iodine treatment. Over those years, I've sent 2 patients for thyroid surgery where I couldn't get it under control with, our regimen of, using iodine and some other nutrients with it. And the rest have done fine with it. And it's those iodine naysayers out there, and they're out there, man. They're out there in the pharmacy world, they're out there in the naturopathic world, and they're out there in the holistic medical world as well. And I would just like, as Ricky said to Lucy, explain that negative association to me and tell me how that happens. Because that disproves iodine causing it right there. Could be something else, but I say it's iodine deficiency. That's a big piece of that pie.
I'm just I feel a little uncomfortable interrupting you so much, but at the same time, the fireworks are going off around different topics related to this. such as the relationship of iodine to increase breast density and the risk that that is. And of course, you mentioned that there's a structural relationship. The mechanism of iodine deficiency in the breast is a breast structure, or would you elaborate on that a little bit? Why iodine is so
Iodine
important to the breast?
deficiency in the glandular tissue can lead to cysts, nodules, hyperplasia, and cancer. And it's all the glandular tissue. As far as density of the breast, I cannot tell you that iodine doesn't worsen, cause more breast density, bro. I haven't seen that. I can't tell you that it helps it either. I can tell you, fibrocystic breast disease, the most studied item in treating fibrocystic breast disease in multiple countries, including the old Soviet Union. There's literally, I don't know if there's hundreds, but I think there's hundreds of articles, citing the use of iodine back to the 1950s through before they fell apart, in the late 1980s, showing iodine an effective treatment for fibrocystic breast disease. I got a bunch of case histories with that where women were contemplating mastectomies because they were so miserable with these like rock hard. I remember one lady, I lecture with her, I use her face, I lecture with her story, and she was about 40 years old, and she was scheduled for bilateral mastectomy for horrible fibrocystic breast disease. She had it for years. She couldn't wear a bra, wear like muumuu clothes or whatever you guys call them, just cover things that hang over. And if anything touched her breasts, she'd start crying because she was in such misery. When I saw her the first visit, she was 2 weeks at the University of Michigan scheduled for bilateral mastectomy. She was seeing the head of the fibrocystic breast disease clinic at the University of Michigan for a year. He had taken her off caffeine, told her to cut out sugar and chocolate, and done some of the dietary stuff, which she did. And she said it didn't help her. It didn't help her enough. So I said, well, why are you here? And she goes, I don't want a bilateral mastectomy, but I'm miserable right now. And I did an initial exam on her, and as I'm doing a breast exam and palpating her breast, the only thing I can describe her breast, I felt this a few times in my life. When I was younger and I used to take Taekwondo, and you'd hit the punching bag, the hard plastic punching, her breast felt like that hard plastic bag with bumps on it. And it felt like alien tissue. I mean, I've just felt it a few times, but not much, and just did not feel like human tissue. So I do my work. She's got this low iodine loading test. She's, I don't think I would have cared what the loading test was, but, because there's so many articles on iodine and fibrocystic breast disease. So I put her on 50 milligrams of iodine. She calls me up 2 weeks into it and says, pain's going down. Because what I told her was, move your surgery back 2 months. Give me 2 months. If we're not making any progress and you're that miserable, then perhaps consider going through surgery, but give me 2 months. 2 weeks, she calls me and says, pain's going down. Like, I see her back in a month. She's pain's down 70%. Now I feel her breast, and it's still lumpy and still hard, but it's like there's some human feel to that now. And then I see her a month after that. Her pain is now down 95%. And she almost has no pain. She's able to wear a bra again. I do another exam. Now she's got human tissue with multiple breast cysts, but they're small. I saw her a month or two after that. The cysts were all gone. She's doing fine. And I did these serial iodine loading tests, which I, use in my lectures. So then maybe 2 years into seeing her, and at that point I was seeing her every 6 months. I get a phone call, 2.5 years, my breasts are hurting again. I can't wear a bra. And I was on the phone, I'm like, that's really unusual. I said, I've done this long enough now. I mean, are you on any new medications, anything? We're talking. And this is one of those things where I would tell other doctors, take a better history than I did, because it took me a while on this phone call to say to her, are you still taking iodine? And she goes, pause, I ran out 3 or 4 weeks ago. I forgot to get it. She goes, I haven't had it for a month. And I'm like, you need to take iodine. She took iodine. 2 weeks later, calls me up, says it's gone. And now she's about my age. I think she was 40 when I saw her. So I've been treating her for 20 years. And, she never had that surgery, very good patient. And treated in our office, we treated so many patients like that with that. And we've seen with ovarian cysts, prostate growth, pancreatic cysts, to a point. If those cysts and nodules get big, really, and even the goiter, if the goiter, gets huge and sticking out of the neck, you can stop growth with iodine, but sometimes it won't reverse. The tissue is so disrupted in architecture. But if it's not to that point, many times you get goiters to go away, you get fibrocystic breast disease to go away, ovarian cysts to go away, and so on.
It's absolutely priceless to hear
cheap.
the
something
actual
is cheap.
story.
It's 50 cents a buck a day, something like that.
To hear the story straight from you, though, is extremely impactful. I remember, I think it was Jonathan Wright who told the story of Myers, who used to do these lectures. Did you hear that story? And would you recount
I've heard that story,
please? Would you tell the
No, you
audience?
got to tell it. I haven't heard it in a while, but I know the story. Go ahead.
Well, Dr. Myers was a physician in Baltimore who used to give lectures to physicians, and he would line up women with breast pain and do pelvic exams on the stage. The physicians wouldn't see the actual pelvic part. They would see the head of the woman draped, and he would paint iodine on the cervix. And by the end of the lecture, their pain went away. I mean, I've never heard a more startling story, I think, at all.
You know, he's talked about that, and I did that on one or two women with a big docile, put it in the 5% Lugol's and just touch it, splashed it on their cervix. I can't tell you I had that response where it went away immediately. And
Yeah,
I was putting them on oral iodine too, and it went away.
yeah,
The oral stuff works. And,
yeah, that's right.
you can tell that it works because if you give someone 50 milligrams of iodine, you collect 24 hours of urine, you see it come out in the urine, so you know it's getting absorbed, getting
Right,
cleared by the kidneys.
right.
Do you determine dosing by symptoms largely? I mean, certainly you have your iodine testing and the loading, but is it symptom regulated as well too, or how do you gauge that?
Well, one of the other things I get criticized about, well, your dose is too high. 50 milligrams a day is too high. And you'll hear other people lecture about it. Well, they, meaning me and Dr. Abraham and Fletchus and Hakala, were sort of the four horsemen there. They pulled it out of the air. No, I have a whole lecture on this, where that 50 milligrams came from. It's not pulled out of the air. Dr. Abraham should have got a Nobel Prize for that. And it's a really cool lecture to see where that comes from. And I did that lecture with Lindsay at her hormone summit that we were just finishing. And so average dosing, I can just tell you from doing all those hundreds and thousands of tests on people, my average dosing now is about 25 milligrams for a healthy person. Look, everyone's a unique biochemical individual, should be treated as such. And I'm just giving averages here. And iodine should be part of a holistic treatment regimen, not used as a single substance alone to get the best results. But average dosing is about 25 milligrams for most adults, and 25 to 50, somewhere in there. And if they have glandular disease, a little bit more, or a lot more if they have bad glandular disease. There was a lady, she had metastatic inflammatory breast cancer, the worst one. You've seen those. Once they're diagnosed with that, they're given 3 to 6 months to live, generally. It's all over her body. She's miserable. And she was in my original studies with Dr. Abraham. She I don't want to say lucky, just kind of came in at the right time when I started testing. And I did a study, and she was in that study with 9 women with breast cancer versus 9 women without breast cancer. And it's whoever came in the office at that time. That's all I screened for. There's no randomization. I just took the first 9 breast cancer, first 9 non-breast cancer. She was in that group. And what we found was that when we did the 24-hour loading test, the breast cancer patients had 50% less iodine on the testing and 50% more bromide on the initial testing. Then when we gave them iodine, bromide's in the halogen family, bromide, fluoride, iodine, and chlorine. And 2 of those halogens are toxic, non-essential items, bromide and fluoride. And 2 are essential that we can't live without. It's iodine and chloride. And they're all competitive inhibitors of one another. So if you get too much bromide and fluoride, you'll get less iodine. And if you put iodine in, you can get bromide. And iodine and bromide are the closest in size and shape to one another. They're the ones that are going to competitively hit one another primarily. Fluoride's a minor player in this. But the breast cancer patients had 50% more bromine than the non-breast cancer patients. And then when we started treating them with iodine, their bromine levels skyrocketed. Now hers skyrocketed. And she called me up. So I put her on 50 milligrams of iodine a day in this study. We're gonna check levels day 1, time 0, day 1, and day 30. So 2 weeks into the study, she calls me up and she says, I got a problem. What's the problem? She goes, my fingernails are turning yellow. I said, are your eyes yellow? No. I said, how do you feel? She goes, I feel better than ever before. I'm babysitting my grandkids again for the first time. And I said, come in. And she said, my nightshirt's got yellow stains on it where my breasts are, what she sleeps in. I said, bring your shirt in. So she comes in the office.
This is the woman with breast cancer?
Metastatic inflammatory.
You're right. Got it. I hear you.
She comes in the office. I got pictures. I got a whole lecture on her too. I got pictures of her nails. They're yellow. Now they're not jaundice yellow. They're yellow like riboflavin yellow or something like that. They're yellow. I look in her eyes. There's no yellow. She's got this white nightshirt, and I look inside the inside part of the shirt, and it's yellow stained right over her breast. The rest of the shirt's white. So I asked her if I can keep the shirt. She says she feels great. She goes, what do? I'm like, stay in the iodine. I mean, she's just going to die. She feels good. She looks better. Her color is better, except for this yellow nails. And she tells me when she takes a bath, got a yellow ring around the bathtub for 2 weeks.
Wow.
So I tell her I want to see her in 2 weeks. We do another collection. Her bromide levels had skyrocketed in that first day. 30 days later, bromide levels were coming down, but still high. But that yellow color went away about 10 days later. The yellow ring around the bathtub went away. She felt good. She lived six and a half more years. She died of metastatic inflammatory breast cancer. My regret was I should have used more iodine. But the part of the story, so I call Dr. Abraham and I tell him the story. He goes, "Did you get the shirt?" And I'm like, "Yeah." And he goes, "Well, let's do a study on the shirt. See what the yellow is." So he goes, "You're coming out in a month, bring the shirt." So I put the shirt and I put it in I got a Quest bag because Quest Labs in our office, sealed it, put it away. So a month comes, I'm going to Dr. Abraham's. I can't find the shirt. I tear the office apart. I got staff looking for the shirt. It's not in the office. So then I think I took it home. I don't really remember now. So I look in my house. I can't find the damn shirt. She's doing fine, by the way, So we don't do the testing on the shirt. So 15 years later, Dr. Abraham dies in the interim. We're moving houses. So I'm cleaning out my house. I clean out my office and I have these shelves. If you can see behind me, I'm not, it's organized. I know where everything's at. It's maybe not the neatest in the world. But I had these shelves, and I'm pulling stuff out of the shelf. And of course, it's one of these shelves where I just kept shoving crap in there. I go in there. This is like 15, maybe 17 years later. The shirt's in the bag. It was unbelievable. It was like finding a needle in a haystack. I can't believe it. So Dr. Abraham's dead. Can't call him. So, but Charles Hakala was one of the horsemen, that was going out there and doing it. And by then he had that fancy machine that can test vitamin levels and toxicity levels. What's that called? He really had an upgrade to how we were testing iodine, bromide, fluoride levels, and he could test anything. I called Charles. I'm like, "Charles, I found the shirt." So we did a study. We took out a couple patches on the yellow and a couple patches on the back, which were white. We did the study. We found these huge bromide levels on the front part of the shirt, nothing on the back side of the shirt. I am going to write this up as a case history and try and put it in a conventional journal, which Charles and I are going to do this summer. And I've talked to him about it, but that was a really cool study. And my regret with her was I should have used more iodine. I maxed her out at 50 milligrams because that's all I knew back then. At this point, I'd have her on a couple hundred milligrams as part of a holistic treatment regimen.
Speaking of that, I mean, if I remember, there was surgeons often would give iodine to suppress a very active Graves' disease before operating.
That's a good memory. So that is true. That was the treatment for Graves' disease back in the day. They would give enough iodine to calm the thyroid down, then they do surgery.
Right.
So I had a patient with Graves' disease that I just couldn't get under control. She needed antithyroid medications along with iodine. We couldn't get her off the antithyroid medications. And finally I said, she's one of 2 or 3 in 20 plus years. And I said, "You got to go to surgery." So this guy I was roommates with at Michigan in undergrad is a surgeon that I send a lot of patients to. He's going to do the thyroidectomy on her, and he wants to put her on all these toxic meds to calm her thyroid down. I said, "Hey, Rick, can I use iodine? I know how to do this." And he said, "Well, I don't know about it." So I copied off chapters in an old book about this. He read it. And he said, "Go for it. As long as the thyroid's under control, I'll do the surgery." And so I did it. And he did the surgery. I've done that for those 2 or 3 patients. That's what I've had to do, along with a little bit of antithyroid medication. But you're right. That was the treatment for it back then.
Do you ever get concerned, or do you check people that you put on 50 milligrams of iodine? Do you check their thyroid function? Do you ever see a suppressed thyroid?
Of course, I check the thyroid function. It should be done. Do I see a suppressed thyroid? So you're asking for iodine-induced hypothyroidism, which is called literature. And all those naysayers with iodine quote all these stupid studies, which they put them on decent amounts of iodine, and then they'll quote the TSH going up to 6 or 15 or 20, and it's causing iodine-induced hypothyroidism. And there's dozens, if not hundreds, of these studies out there. Of course, these studies don't report their T4 and T3 levels, because I see it too. TSH goes up after you put them on iodine initially. It's a natural and expected response. That's what should happen with someone who's iodine deficient, because to move iodine from the bloodstream into the glandular tissue, there's a taxi cab called the sodium iodine symporter. It's responsible for that. And to make sodium iodine symporters, to make these taxi cab, it's stimulated by TSH. So if someone's iodine deficient, they're not going to have these taxi cabs just sitting on idle waiting for iodine to come to move it from a low concentration into a high concentration area, which is an ATP energy dependent process. It's only going to be made when TSH goes up. So someone who's iodine deficient, when you give them iodine, I go through this whole mechanism of how this is done for doctors. It's expected that TSH will go up. However, if you just do a quick exam and talk to them and ask them, "How do you feel?" they're going to tell you they feel better. They don't feel worse. They don't feel hypothyroid. And if you check T3 and T4 levels, those are usually fine. without showing signs of
Amazing.
hypothyroidism. This is a
Amazing.
temporary phenomenon to make sodium iodine importers.
Amazing. And does the TSH eventually come down?
It takes 6 months, 4 to 6 months in most people for it to come down. Some people 9 months. Yes, it comes down. Look, there's an occasional patient that thyroid levels get screwy with iodine. We all see them in our office, and you'll see, you put them on iodine, their TSH will go up to 80. The T4 will usually suppress right to the bottom of the reference range, right around there. And T3 will be fine, be in the middle of the reference range, maybe in the upper third, but in the middle, they'll feel fine. You're not going to complain of being hypothyroid or hyperthyroid. And you got this TSH in the 80s, and I haven't figured out what to do with those people yet. And because other doctors will go nutty on me about a TSH in the 80s or something, I tell them they got to come off iodine. But those, I mean, look, that's a patient, maybe a patient a year or less than that. It's less. That can happen, but they don't feel bad. And then the only other thing with iodine to be watchful for is an autonomously functioning nodule, where they've got a nodule that's the thyroid gland has lost control of. You give iodine anywhere from any source, that nodule takes up iodine quickly, makes a lot of thyroid hormone, they get hyper right away. The only way to diagnose that is either you give them iodine or you do a radioactive iodine uptake test and you see a hot nodule. I've had 3 of those in 25 years or so, and they can't take iodine or they need surgery to get their nodule removed. And that's about the 2 problem things with iodine that I see.
How about, do you ever treat prostate or pancreas or fibroids or ovarian cysts? Would you talk about that?
Yes to all that. However, if the fibroids are huge, iodine many times will stop future growth, but you're still stuck with fibroids.
Yeah, right.
If the prostate nodules are hard and been there for a while, it might not get bigger, but you're stuck with the nodule.
Yeah, right.
And the same thing with the thyroid. I've got this series of this young man who was 16 who I was treating mom and dad, and he had a goiter, and the endocrinologist wanted to give him radioactive iodine. She asked me about it, and I told her it's going to radiate his testes, it's going to radiate his pituitary, it's going to radiate, skin. I wouldn't do that. And so I've got these serial pictures on him. His has come down. He's still like 1.5 times normal on his thyroid, but it was sticking out of his neck like this. So I've got his down about 90%, and he's 26, 27 years old right now.
Wow.
And just kind of stays there with it. And he's got normal thyroid function and feels good. And, his headaches and all that stuff went away, once we got him on iodine.
How about mild elevations of PSA? Do you ever see them reduce under iodine treatment?
Unfortunately, no. I wish I had something better to say about that one, but no.
Yeah, amazing. And so can we drift over into breast cancer and breast cancer prevention? And
look, I don't think there's any better breast cancer prevention besides eating good diet and exercising and drinking water. Look, I always say to people, do the basics. Basics in my mind are eat good food, keep refined food source, particularly refined sugar, out of your diet. Don't drink alcohol or keep it to a bare minimum. Exercise and iodine. I include iodine as part of that basic stuff. And particularly in our world with our overexposure to those toxic halogens, bromide and fluoride, man, those things are everywhere. I can see all 4 of us are sitting down. Our rear ends are on bromide cushions right now. There's bromide in this thing, we're putting up to our head to talk to. Bromide in food and drink. You got fluoride in food and drink. Fluoride and bromide are chemical constituents of a bunch of medicines. That's what's raised our iodine requirements compared to our predecessors. We're more iodine deficient. We're suffering more. We have, you guys all know, our health of our country sucks. Just terrible right now.
Do you always have to test, Dr. Brownstein? Do you test everybody? Because a lot of the providers that are listening may not be that familiar with iodine testing. So if a woman comes in with fibrocystic breast, you just kind of say, you can assume that you can start iodine, you've got probably an iodine deficiency, or do you feel like testing is really, it should be done?
I think for those people new to iodine, once they learn about it, I would say do an iodine loading test in the first dozen patients, and then repeat the iodine loading test a few months to 6 months afterwards, and correlate it with how the patients are doing. I think it just helps you feel better with it and just helps you correlate with it. Do I think everybody needs an iodine loading test? No. Now, I did everybody 20 years ago with Dr. Abraham. No, I don't do it. I don't do many of those anymore, period. I do them on people who come in, or there's something interesting about their case that I want to see it. What you can do, though, is a spot urine iodine test. So a spot urine iodine test is just what it sounds like. You just pee in a cup and whatever, and they'll send it for a analysis for their iodine levels. Now, the spot urine iodine only works if they're iodine deficient. If they're taking iodine, we don't have reference ranges for that because 90% of the iodine is cleared through the urine. But if they're not taking iodine, over 95% of people on a spot urine iodine are going to be low according to WHO criteria for what's low on iodine. And that WHO criteria is ridiculous. It's not even, it's for the minimum amount of iodine to prevent goiter. It's not for optimal amounts of iodine, to supply iodine for the rest of the body. So that's one thing you can do. No, I don't think everyone needs testing, just like I don't think everyone needs to be tested for vitamin C or magnesium before you put them on vitamin C and magnesium. And I would also say if they got fibrocystic breast disease, they got iodine, I would say you could confidently make a diagnosis that iodine deficiency is probably there with it.
I do have a case of a woman in her mid-40s, nulliparous, who had breast pain and fibrocystic breast disease. And we had initial thermograms on her, and you could see the heat. And we gave her iodine, and we have sequential thermograms on her, and that heat disappeared and her pain disappeared.
I've got case histories on that too. The same thing, exact same thing. This lady, so I saw her daughter. Her daughter was told to get her affairs in order from disseminated thyroid cancer, metastatic thyroid cancer, and put her on iodine. All that went away. All the lymph nodes, everything went away. She was given 3 or 4 rounds of radioactive iodine, and the fourth one, or whatever the last one was, almost killed her. And they told her, just get your affairs in order. She had little kids, so got her going on iodine. She had read something or read my book or something like that. And so she sends her mom in. And her mom's just like you described. She's got stage 4 breast cancer with to the liver and a lesion in the brain. And mom's like in her 80s. Mom is a very religious, conservative person. If God wants to take her, God's going to take her. She's not doing conventional medicine on this. And she was married to a chiropractor who was really into natural things, who had died previously. So she didn't want to do it. So we have those serial thermoscans like you do, showing the hot areas just cooling off over about 2-year time period. And she's now 10, 12 years still seeing us. Never had a mammogram. Never had another body scan. So we don't quite know if she's got liver involvement or lymph nodes, but the liver enzymes that were up are now normal. And she's still perking along in her late 80s now. So those are cool stories, and it's cool to have those pictures.
It's so exciting. I feel tempted, and of course we could perhaps have another interview with you just to start hearing your stories about thyroid. We haven't even touched thyroid with you very much. Your preference? We don't want to overstep our.
No, we could do it again. I don't mind talking, especially when people are intelligent and, unlike some of these holistic colleagues out there who I don't know what they're, I think people get these ideas in their heads and they just are not going to change no matter when you're confronted with facts. And, they throw that quote at me that iodine for Hashimoto's patients is like fuel on the fire. I'm like, please bring it on. I will explain it. I was iodine illiterate back then. I was not knowledgeable about it. That was my knowledge at the time. I'm thankful I'm past that. And
so for Hashimoto's, you can get benefit for Hashimoto's with iodine.
So
would you elaborate on that?
I have around, my girls were about 11 and 12, maybe 10 and 11 years old. We're having dinner, and my wife says to me, do you think they have a thyroid problem? And I remember I had a fork full of food ready to go in, and I stop and I look at her, and the kids are complaining they're tired. They got headaches all the time. Now they're playing soccer, and they're, and I don't know, maybe, it's like the shoemaker's kids without shoes. I do this all day, but I can't see it in my own kids. So I've got the fork there, and I remember I hit myself in the forehead. I'm like, they might. And I've just been ignoring their complaints. So I had them come in. They got rip-roaring Hashimoto's, hypothyroidism, titers 500 plus of TPO and thyroglobulin, and said maybe 800 or 900, and hypothyroid. So put them on iodine, and I got those studies where I lecture and I show the serial studies of them, and you see their titers come right down as they're on iodine. My daughters, who are both doctors now, working in my office, have no signs of Hashimoto's, and so those who say that iodine causes, if you have Hashimoto's, you can't take iodine. If that's your hypothesis, a hypothesis to be true has to withstand all criticisms. Well, I got an N of 2 that I raised, that I got the proof with the labs showing that ain't true. So come up with a new hypothesis. And we already went through the Ricky to Lucy comment, explain that one. But, iodine, Hashimoto's forms from iodine deficiency. For the vast majority of people, iodine effectively treats Hashimoto's and gets rid of it. If you're younger than about 50 years old, pretty easy. Over 45, 50 years old, sometimes you can get rid of it, but many times you'll drop the titers in half or 3/4, and it'll just be behind the scenes. The titers never go, they don't get normal or zero normal or close to zero, but they don't have any signs of Hashimoto's. They just got these low level titers that hang around. And but kids are easy to treat with it.
Yeah, just for clarification, if you get a history that suggests functional hypothyroidism and you get some testing that suggests it as well, do you automatically start them on thyroid these days, or are you automatically starting somebody on iodine?
What I always tell, the professionals out there is I would not put anyone on thyroid hormone without ensuring they have enough iodine. And if you don't know, I would put them on, what I try and do most of the times is put them on iodine first, wait a couple weeks to a month, see how they do, retest and see where they're at. Or if I'm going to do it and they're miserable, TSH is 150 and there's 0 T4, T3, I'll put them concurrently on iodine and thyroid together. I never do it alone anymore.
Yeah.
From
Oh,
those two studies that show that if you do it,
Mm.
you'll increase the risk of breast cancer and who knows what else cancer.
Oh, yeah, right. You never do thyroid alone anymore.
No.
You always started by the iodine. And 2 months.
Or concurrently.
You'll retest as early as a month or two.
I'll retest thyroid levels maybe sooner than that, but iodine levels,
Yeah.
I would never put anyone on thyroid hormone without iodine. Either do iodine first, then put them on thyroid hormone, or both together.
Wow.
Start.
So in that situation, would you start at your 50, kind of your bolus loading dose, if you will? Or would you jump to, what's your thought there?
So if you're seeing patients daily, right? Full time. So, I mean, you've got these sensitive patients that I have too, right? These people are taking, they take magnesium at 200 milligrams, they're going to be a mess, right? So for those patients, I'll start off lower.
Okay.
And maybe 6.25. I'll start off milligram doses.
Okay.
Then go up from there quickly as they tolerate it. If there's problems with iodine, a quick little treatment for it is have them stop. So what's going to happen is you give them someone iodine, they're full of bromide.
Yeah.
They're going to get a detox reaction with bromide coming out, and they're going to get sick from that. They're not going to feel good and headachy and fatigue, and they don't like that. So what I have them do is stop the iodine and take salt, like a teaspoon or two of unrefined salt a day for 2 weeks, then go back to the iodine. 99 out of 100 times they can start taking iodine at that point. So just as I mentioned to you, David, that I don't use thyroid alone without iodine, I don't use iodine alone without salt in anyone, unless they have CHF or renal failure. Then I'm more cautious with salt. But I'm more cautious with iodine and renal failure patients too, just because they got to clear it through their kidneys. Even though I've never seen iodine raise kidney function, ever, including renal failure patients.
David Brownstein, I'm just so touched when I think about, here's an hour of you talking about this, and I just imagine the number of patients, the number of flights to California, the number of experiences.
I hated being in that lab. Oh my God, the beakers and you're measuring and this you had to wait, and oh my God, I've never been a lab nerd. I never liked being in the lab. I never liked all that stuff, but it was a great experience, made me a better doctor, and I wouldn't trade it for anything. And I wish Dr. Abraham was still, I wish he could have been here when I found that damn shirt. That was something.
That's so great. We appreciate you bringing this to us and just continuing to educate, because this is still, as we spoke, demonized, and iodine is the devil, much like hormones, right? There's so much misinformation out there. So we appreciate the time you spent, not only with us, but just the ongoing education and the seminars and your books are fantastic. So thank you.